Hello mga ka-listeners. Now we will have to talk about your antimycobacterials or antimycobacterial antibiotics. Okay, let us discuss first about your antimycobacterial antibiotics. Okay, let me draw your attention about the term antituberculosis and leprostatic drugs. Actually, these are also a subclassifications of your antimycobacterial antibiotics. When we say anti-tuberculosis, it is against with the Mycobacterium tuberculosis. This is the causative agent of your pulmonary tuberculosis. While on the other hand, the leprostatic drugs are against with the Mycobacterium leprae. It is the causative agent for your leprosy. It is also known as your Hansen's disease because the one who discovered this disease has a surname of Hansen. That is why it is called Hansen's disease simply. The Mycobacterium tuberculosis can also spread into the other organs. Um, if it is confined in the bones, that is why it is called TB of the bones. When in the intestines, it is called TB of the intestines. It is located in the meninges, it is called TB of the meninges. So actually, there are broad categories of your pulmonary tuberculosis. We have your intrapulmonary type of tuberculosis that is confined only in the lungs, within the lungs or the pulmonary area. So when it is outside that the tuberculosis that is outside the pulmonary area, that is what we call your extrapulmonary, such as your TB of the bones, as I said, TB of the meninges, TB of the intestines, and many organs which mycobacterium can also spread through. Okay, for just an information, a little information about your tuberculosis. Actually, there are many tests that can tell a person if he or she is exposed or currently infected with the Mycobacterium tuberculosis. We have also your Mantoux test, your Mantoux spelled as Maneous. It is pronounced as Mantoux test. It is actually your tuberculin test. Actually, it uses tuberculin. It is like doing a skin test because it contain actually a PPD or your purified protein derivative. Actually, the test can be read about a maximum of 72 hours, and it tells the person if he or she is exposed to the tuberculosis. Okay, a measurement of less than 5 millimeters of an induration. Actually, if it looks like, as I mentioned, it is like you're doing a skin test. There's a bleb. Imagine that there is a bleb. So you measure the size of the induration. So if it is less than 5 millimeters, it is said to be that most of the individuals are immunocompromised. But actually, what is the positive um, test that will tell you in relation to the Mantoux testing? Okay, a measurement of more than 15 millimeters is said to be that you are positive for the tuberculosis, pulmonary tuberculosis. If the measurement is about less than 10 millimeters of induration, it is said to be that you have an exposure to the PTB. And also, we have another test. We have your sputum test, by the way, that confirms the 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 tuberculosis. It is a confirmatory test for your tuberculosis, the sputum test, because nakikita mismo yung causative agent, no, from the sputum na sinasubmit ng pasyente. While on the other hand, we have also your X-ray. Your X-ray actually, it is used for to determine the extension of the lesion caused by the Mycobacterium tuberculosis. So again, we have the confirmatory test, and we have your Mantoux test. Actually, your Mantoux test serve as a gold standard to test the individual if he or she is exposed to the tuberculosis. Okay, let us talk about the drugs involved in your tuberculosis. Okay, your anti-TB drugs are actually, it is known to be abbreviated into RIPES. So what is RIPES? It is R stands for your rifampicin. I stands for your isoniazid. P stands for your pyrazinamide. We have your E stands for ethambutol. We have also your letter S stands for your streptomycin. So as a nurse, actually we must have to familiarize this um, anti-TB drugs because you can also use this concept, especially in some of your concepts in community health nursing, because you will be also talking about the tuberculosis, okay, the drugs involved in treating the um, tuberculosis, whether it is an intrapulmonary form of PTB or extrapulmonary form. Okay, as I said, rifampicin, isoniazid, pyrazinamide, ethambutol, and streptomycin. In terms of the metabolism of the drug, your rifampicin, isoniazid, pyrazinamide are metabolized by the liver. Okay, again, metabolized by the liver. Your metabolism is also known as your biotransformation. So it is also appropriate to say that it is biotransformed by your liver. While the remaining two anti-TB drugs, we have your ethambutol and your streptomycin, are metabolized or biotransformed by the kidneys. Okay, example of your anti-TB drugs, we have actually your myrin P40. Actually, those drug depends also, the generic name is still the same, while the brand name, actually it depends on the drug manufacturer. So we have here the example, your myrin P40. Actually, your myrin P40 is just a combination of 4 TB drugs that is in one tablet. Kasi before, noong unang panahon, yung mga anti-TB drugs are given one by one. So, for example, I will take ethambutol. The patient will go to the community health center to ask for ethambutol, and for the another day, he or she will ask for the rifampicin. So, we are glad that today, in our generation, that the anti-TB drugs are actually combined in one tablet. So that is a fixed dose combination of your anti-TB drugs. Since it is a four, it is combined into one tablet. There are 4 TB drugs, as I said. We have your ethambutol, 275 milligrams, plus we have your INH. That is your um, 75 milligrams. We have your PZA, your pyrazinamide, that is 400 milligrams, and we have your rifampicin. Actually, your INH, that is your isoniazid. Okay, your isoniazid. Actually, it is taken orally, okay, given daily, and some of the computations of their dosage relies on the weight of the patient per kilogram. For example, 45 to 54 kilograms. So the patient may be given 3 tablets every day. Then, if the patient weighs 55 to 70 kilograms, so the patient may be given 4 tablets. And if it's more than or equal to 71 kilograms, then the patient may be given with 5 tablets. So that is the dosing of your anti-TB drugs. There are also another brand name of your anti-TB drugs. We have your quad tab, that is still there are 4 TB drugs in one tablet. Your Fixcom 4 TB drugs in one tablet, the same thing. We have your Rimstar 4. We have your, it has same composition, 4 TB drugs in one tablet. Myrin, your myrin has a 3 TB drugs in one tablet. For example, your ethambutol 300 milligrams, isoniazid, your INH 75 milligrams, plus your rifampicin. And Tritab, same thing with your myrin. There are 3 TB drugs in one tablet. We have also your Fixcom 3, still 3 TB drugs in one tablet, given all as per orem. Okay, if you notice there is a streptomycin, actually, if you remember, streptomycin is classified as one of your, guess what? That is your, very good, that is your aminoglycoside. Actually, your streptomycin is given via deep IM. So it is on given parenteral in a parenteral route. If you still remember that your streptomycin is highly ototoxic since because it is classified as aminoglycoside. As a nurse, we must have also to be aware that there are possible effects of your anti-TB drugs. So what are those side effects? Common side effects with your rifampicin. Actually, the rifampicin in other country they called it as your rifampin. Okay, rifampicin. Actually, they are the same. Actually, your rifampicin causes red orange urine. If a patient asks you, is it normal or is it worrisome? Actually, it is a normal or an expected finding if a patient is taking rifampicin as one of the anti-TB drugs. So again, it is the color of urine, it is a red orange. And your isoniazid, since I mentioned it is an INH, INH stands as your isonicotinic acid hydroside. That is your INH, or also called as your isoniazid. Actually, your isoniazid causes a peripheral neuritis or neuropathy. Actually, when we say peripheral neuritis, there are actually mga nerves, no? Mga nerves na possible na ma-damage because of these anti-TB drugs. Or when we say peripheral neuritis or a neuropathy, these are actually a condition that results when the nerves that carry messages to and from the brain and the spinal cord from and to the rest of the body are damaged or or being affected. Okay, it is your peripheral nerves actually are affected. That is why there is the term peripheral neuropathy or neuritis. Peripheral nerves actually make up an intricate network that connects the brain, the spinal cord, to the muscles, the skin, and other internal organs. So that is your peripheral neuropathy. So how to prevent this complication? That is why the patient who is taking isoniazid, he or she may be given with a vitamin B6, also known as your pyridoxine. That is to reduce the peripheral neuropathy. How about the pyrazinamide or your PZA? Actually, your pyrazinamide, as I mentioned earlier, that it is metabolized by your liver. Actually, it is hepatotoxic. Hepa means liver, toxic to the liver. Actually, it causes hyperuricemia, or there is an elevation of your uric acid in the blood, and also it causes hepatomegaly. Your hepatomegaly, that is enlargement of your liver. Hepato means liver, megaly means enlargement. So generally, it is hepatotoxic. So as a nurse, how can you advise the patient while he or she is taking pyrazinamide? Actually, it is in their diet. Actually, you must have to advise them not to take food that are rich or it has a high levels of uric acid. For example, that is your beans, because it has a it can elevate actually your uric acid in the blood, causing a condition called hyperuricemia. So that is one of the points that the nurse must teach the patient. How about your ethambutol? Your ethambutol, actually, it causes optic neuritis. Okay, what is this optic neuritis? Your optic neuritis actually occurs when there is swelling or inflammation, and it damages the optic nerve. When we say optic nerve, this is a bundle of nerve fibers that actually transmit visual information from your eye to your brain. That is an optic neuritis. Common symptoms of your optic neuritis, actually there is pain with eye movement and temporary vision loss in one eye. So that is your optic neuritis as one of the complication of the anti-tuberculosis drug, especially with your ethambutol. Last is your streptomycin. As I said, it is an aminoglycoside. It is ototoxic. When I say ototoxic, the word auto there is ear. So toxic on the ears. Actually, because the mechanism of this drug, it can damage. No, it can damage, or it can impair the cranial nerve number 8. If you still remember, that is your vestibulocochlear nerve. If you still memorized your cranial nerves, well, that is good. That is again, that is your streptomycin. It can impair the 8th cranial nerve. Again, it is ototoxic. Okay, let's go about the concepts on leprostatic drugs. So as I said, it is a drug that are against with a Mycobacterium leprae that causes leprosy or Hansen's disease. So what are the common drugs that is given? We have your dapsone. Your dapsone, actually it is a common drug for the treatment of leprosy. It is similar for your sulfonamides. If you notice, sulfonamides spelled out as PHO can be spelled like that, or spelled as FO, sulfonamides, still the same. Okay, again, it is similar to the sulfonamides that actually it inhibits the folic acid synthesis. So because the folic acid is required for the normal synthesis, actually for the growth of the bacterial cells. So when you inhibit the folic acid, then there can be no formation also of the DNA. When there is no formation of the DNA, then there can be no normal cell division among those bacterial cells, and eventually those bacteria may die. The same thing with your anti-TB drug. Actually, the target of those drugs is the DNA of the bacterial cells, leading to bacterial cell death. Actually, your dapsone can also be given for AIDS patient. Now, AIDS patient with a complication, they call this complication as your pneumocystis carinii pneumonia. And also for condition, we have your brown recluse spider bites. Those are some of the indication of your dapsone, not only for the leprosy alone, but in other condition or complication of other medical conditions such as your AIDS, as I said. And another leprostatic drugs includes your rifampicin, or as I said, your rifampicin is the same with the rifampin. Your rifampicin is also your anti-tuberculosis drug, which can also be given among patients with leprosy. And also we have your clofazimine. How the leprostatic drugs may be given to the following patient with leprosy? Actually, it depends on the classification of your leprosy. Based on the classification of your World Health Organization, we have a paucibacillary type and multibacillary type. Actually, your paucibacillary type of leprosy, this is actually a non-contagious stage of your leprosy. Okay, if you know what is leprosy, if you have an idea about leprosy, actually your leprosy is a chronic, it is a progressive bacterial infection. As I said, it is caused by your Mycobacterium leprae. Actually, it affects primarily the nerves of the extremities, the skin, the lining of the nose, and the upper respiratory tract. And leprosy produces also skin ulcers, nerve damage, and muscle weakness. As I said, there are two broad classifications of your leprosy based on the World Health Organization classification, because there are also other way of classifying your leprosy. Based on the WHO, we have your paucibacillary type. Actually, when we say paucibacillary, there are actually 5 or fewer lesions, and there is no bacterium detected in the skin samples. Actually, the test for your leprosy, we have your skin slit smear test. Again, it is your skin slit smear test. That is a test for your leprosy or your Hansen's disease. Actually, the mode of transmission, for the information of everybody, the mode of transmission of your leprosy is your prolonged skin to skin contact. Okay, how is the drug for leprosy can be given based on the classification? For paucibacillary type, your rifampicin, it is the patient may be given with rifampicin plus your dapsone. Actually, your rifampicin is given once a month, while your dapsone is given daily. For multibacillary type, actually, as I said, when we say multibacillary, it is defined that there are more than 5 lesions. No? Pag sobra ng mga 5 lesions, and then the bacterium is detected in the skin smear or both, then actually, generally, they are classified as multibacillary. So, more than 5 lesions, multibacillary. If there are 5 lesions or fewer lesions, that is your paucibacillary. Your multibacillary, in contrast with your paucibacillary, that is contagious. Again, your paucibacillary is contagious, while your paucibacillary, again, multibacillary is a contagious one, while paucibacillary is a non-contagious. So, how is the following drug? How are the following drugs may be given to those patients with multibacillary type of leprosy? Actually, they are given with rifampicin plus dapsone plus clofazimine. Okay, your rifampicin is given once a month. Your dapsone is given daily, and also your clofazimine given as daily. So that is some of the important points that we need to consider when treating the patient with leprosy or Hansen's disease. I think we must have to end up at this part. We have we need to discuss also other classification of your antibiotics.